keep expecting to see Tom Cruise, and instead you see Pee Wee Herman. Bummer. Good morning. Okay, good morning. We have to ask your legal permission to talk to you. Hopefully you saw in yesterday's clinic the reasons and the advantages of talking in a public room. That is something that justifies to us kind of breaching your confidentiality. We take that very seriously. On the other hand, we think there's a tremendous advantage to you having seen other patients who've been through the surgery. But each day we have to reaffirm that that's what you want to do and that it's all right with you. And so to avoid federal prison, I'd like to ask for your legal permission to talk to you all this morning.
Yes.
Okay?
Yes.
Good. And you understand also that you might have something personal and private that you don't want to discuss, and you can go ahead and keep that to yourself. And if you want, after we're done, we can have a private discussion if you have something personal and private you want to talk about. So with that, we're going to do kind of the same thing we did yesterday. The idea is that we're going to talk, chat, try and answer questions. But even if you don't have any more questions, we're going to talk for about an hour or so because we've got a problem. The problem that I'm dealing with that's disappointing to me is you don't live next door. In a perfect world, in an ideal situation, your doctor is a family friend, someone you've known maybe for a long time, somebody that you can rely on, somebody that lives next door. And only after that relationship, the doctor-patient relationship has been developed, then can you appropriately and reasonably trust that person with your health and your life. And so today, we're making this kind of relationship kind of on the fly. It's kind of like we're the result of internet dating. And there's problems with that, in other words, the idea that you haven't spent a long time with me, a long time getting to know me is an issue. And we hope in part that we have facilitated ways to get around some of those problems. So for example, you've seen the results of my care and the satisfaction of my patients in dozens and potentially hundreds or even thousands of people if you took the time. So we practice in a way that's very unusual. As we just got your permission again to talk with you this morning, that's very unusual. You have seen yesterday people volunteering to be videotaped on the internet commenting about not only their surgery but also my medical care as a physician. So we're doing what we can to get around that, but today is one more effort to get to know one another, to spend time with you. If you think about it, all you really need me for is those few minutes in the operating room today. But then I need to be available to you over the long term if you get a complication or a problem or if you have a question. And the other thing is, it's just part of good medical care to try and build a solid relationship between us. And it's going to be better if we take more time to do that. I don't make you come 3, 4, 5, 6 times ahead of time. We try and do it so it's convenient for people who are far away. But we have to understand that that's a problem and deal with it the best we can. So this morning, even if you have no more questions, we're going to sit and talk for about an hour. So some people, when they're like all lined up and ready to go, they'll hear me just talking and droning on, and they'll be like, okay, go around, introduce them, and get to the third person and say, what, do you have any questions? No, I have no questions. Can we get going? And what I say is no. No, this morning is part of our kind of relationship building. We're going to be here for an hour regardless, and that's kind of our plan for this morning. I need to apologize that those of you are in a rush, but we're going to take that extra time this morning, so we apologize ahead of time. So good morning.
Good morning.
You were pretty quiet yesterday.